for the Commonwealth Pharmacists Association for the COVID-19. Please stay on mute and ideally switch your video off whilst you're not talking, but you're welcome to keep your video on if you wish to as well. If you do have any questions, please type them into the chat box, and my colleague Nikki is on the call as well, and as well as Sarah and Vicky will show you who we are shortly, as well as esteemed panel from across 5 continents. During this webinar, we're going to focus on an introduction to Commonwealth Pharmacists Association. We'll provide you with some updates on COVID, remembering that in the first webinar, we went into a bit more detail on COVID. We'll share some data around across the Commonwealth. Then we'll go into the main section for this webinar, which is a question and answer with the panelists. We'll then wrap up asking you, the delegates and the panelists, if you've got any further information, and then we'll talk about what the next steps are. We've designed the questions for this webinar based on the feedback that we've had from you throughout the last few weeks, either through the survey that we did or also through the webinar feedback that you gave to us. So today we're so pleased to have with us Manjiri Gharat, who is from India. We've got Hwalin Law from Singapore. We've got Anri, who is from Australia, Andrew McLachlan, Anesa as well from Trinidad and Tobago, and Anri from South Africa, as well as Winnie, who is from Uganda. So as you can see there, we have panelists from across the 5 continents. And at the bottom section, those pictures there are Victoria Rotta on the left, who is the Executive Director for CPA, Sarah Kavanagh, who is our International Partnerships Lead, Nikki Darcy, who is our project lead, as well as myself, who is the Global AMR lead for CPA. The panelists will have an opportunity to introduce themselves, and yesterday we shared their biography with across our newsletter, and as well as those who are coming onto this webinar. So you would have had an opportunity to hear about them, but very shortly, as Sarah takes on the question and answer panel, you'll be able to find out even more about them as they talk about their roles and also the role of pharmacists in their countries or regions. So I'm going to hand over now to Vicky.
Thanks, Diane, and welcome everybody. It's great to see so many of you, some familiar faces and some new ones as well. Just a quick run through for those of you that were on our first webinar. We spoke a little bit about some of our work. I'm just going to update that today and have a quick run through some stuff you've probably heard before if you were on the last one, but just please bear with me for those people that haven't heard this before. So for those of you that don't know us, we're the Commonwealth Pharmacy Association. We're a charity, and our mission is to empower pharmacists to improve health and well-being throughout the Commonwealth. We support the safe and effective medicines management, healthier lifestyles, and reduction of health inequalities. And we achieve this through building strong collaborative networks throughout the Commonwealth with pharmacy associations and associated organisations as well. And we partner with member organisations such as these to improve the quality of pharmacy practice and ultimately the use of medicines for the benefit of the public. We've done this in many ways, including creating platforms for the dissemination of knowledge about pharmaceutical sciences and professional practice. So there's just some pictures there of some of the work that we've done in the past. Some of you may be familiar with our Farm Aid scheme. You can see some of the books there with our colleagues in Rwanda, just to give you an idea of some of the things that we do. Do you want to move on to the next slide? Just to say that if you are on Twitter, we're going to be tweeting about this. Please feel free to tweet, and there's a hashtag there, hashtag CPA COVID-19, that we're using for the webinars. So if you want to include that, that'd be great. So just as I mentioned, some of our core activities, and the one many of you may be familiar with is Farm Aid, where we collect the recent editions of the British National Formulary each year and some of the other texts and send those out upon request to our national pharmacy associations around the Commonwealth. We've got a long history of holding joint conferences as well with different national pharmacy associations to really amplify some of the messages that they were trying to get across, especially to policy leaders and governments, and to strengthen the profession in those countries and give a more international feel to their conferences. We were due to hold our next one in Rwanda later this year. Obviously, with the COVID-19 pandemic, we've had to sort of put that on hold, but that will hopefully be coming soon, so watch out for some more information on that. Education's been a big role for us, and we used to be holding a lot of face-to-face workshops. Now we've done more online delivery, and we're currently creating continuing professional development resource for pharmacists around the Commonwealth in collaboration with member organisations. And for those of you that have been on our virtual tour, you'll know about that. For those of you that haven't had the virtual tour yet, we'll talk to you a bit more about that when we come to you, but it's a very exciting development. We've also done a lot around antimicrobial resistance. The Commonwealth Partnerships in Antimicrobial Resistance programme is currently running in 12, I think it's 12 African institutions, or it might be slightly more now, in 4 African countries, and that's a knowledge and skills exchange between UK NHS pharmacists and healthcare professionals and those in their partner countries, and that's to strengthen the antimicrobial stewardship capacities. So AMR has been a big part of our work. If you want to follow that campaign, that programme, there's a hashtag for that. It's hashtag CWPAMS, and you can look for that on Twitter. There's a lot of activity around that. In terms of campaigns, AMR has been one of the top ones that we've been promoting, and also linking in that into the World Antibiotic Awareness Week that WHO runs each year, and the Antibiotic Guardian campaigns. The other campaign that we've been very involved in is Fight the Fakes, which is looking at trying to address the use of substandard and falsified medicines in the Commonwealth, and that's something that we've been talking to policymakers and governments about as well. So that leads me to kind of the last point here around our advocacy role. The CPA has got a very unique niche and position, and we're linked up to governments, health ministers through the Commonwealth, and we do have the ability to send statements and official kind of advocacy reports and advocacy avenues, so we can help to amplify the messages that our members are trying to get across. And we've done that in various ways. Most recently, we've published a paper in the Journal of Pharmaceutical Policy and Practice, which is our official journal, and that has outlined some of the kind of high priority areas for pharmacy that we would like policymakers to address in line with the Commonwealth Heads of Government meeting agenda that should have taken place this year, but has been postponed because of COVID again. So moving on, I hope you're all staying with me. I'm trying to run through quickly because I want to concentrate on the discussion. So this is just basically a slide showing some of the responses from around the Commonwealth, and just to say thank you to all the pharmacists here and to your colleagues. The response to COVID-19 around the Commonwealth has been phenomenal, and we really appreciate your work. We recognise it, and we hope that others do too, and we're trying our hardest to make sure that that message is amplified. So should we move on to the next slide? This is just for those of you that weren't at the first webinar. If you do want to listen to it, you can go to our website, and there's a direct link there to it. You can then answer some questions, and we can send you a certificate for your CPD if that is what you want. The first webinar was concentrated a lot more on the resources available for pharmacy professionals to help support their response to COVID-19. So our webinar today is going to be slightly different to that, but if you want to know more about the resources, then please go to the first webinar. Should we move on to the next slide, Diane? Just a quick update since our last webinar. We've launched a hand sanitizer animation and some associated interviews. And the idea of that is to guide pharmacy teams through the production of the WHO formula alcohol-based hand sanitizer. And for those of you that haven't seen this, the YouTube link is here. And we've had some really good feedback on that, and it's really great to see, as you can see in this tweet here, pharmacists in Zambia already using this video to help with the response to COVID-19. It caught the attention of the Secretary General of the Commonwealth, and the Commonwealth actually provided funding for this. And it's not just helped pharmacy teams to produce alcohol hand rub, but it's raised the profile of pharmacy amongst policymakers, and that's really, really important, I think, because we want to make sure that following on from this, pharmacy continues to be recognised for the important role that we have in the multidisciplinary team. So if you want to read more about that, there's a full press release there on our website, and the Royal Pharmaceutical Society have also published a blog on that this week, where there is a link there to this. We'll send out these slides afterwards so you can refer to this information as well. So do you want to move on, Diane? So also, since our last webinar, the royal family have tweeted about us, which I think is very exciting. And I just wanted to share that with you here. There's a picture of myself, Manjiri, who is our membership and engagement lead, Claire Anderson, who's one of our trustees, and this is Daniela, who's the president of the Pharmaceutical Society of Kenya. I don't know if she's on the line, but the royal family picked up some of the work that we were doing and tweeted a picture of us all on our virtual tour, and saying how much they appreciate pharmacists and some of the work that we've been doing. So we are getting recognised, and I thought that was a really exciting development, so I wanted to share that with you. So moving on. So just before we start our panel discussion, which is coming straight after this slide, I just wanted to highlight to you some of the data from the Commonwealth Coronavirus Response Centre here. So I've just listed all the countries down the side here who are taking part in this discussion, with the UK at the bottom. Don't look at our figures too much, because they're quite bad. But just to give you an idea that everybody here is at different stages. Some people are still on the upward swing of the curve. Some places have flattened that curve out. And obviously, countries have got different population numbers, different testing capacities, and they're just really at different stages of this pandemic. So I'm hoping that it'll be a really interesting discussion and learning from you all about your experiences. So I'm now going to hand over to Sarah, who's going to kick off the panel discussion. Sarah is our international partnerships lead, and she's been really instrumental in the Commonwealth Partnerships on Antimicrobial Stewardship initiative. So Sarah, over to you.
Thank you, Vicky. Can you hear me okay? So I'd like to introduce the panel. I'm going to do that one by one. If you could really be brief and keep it to 2 minutes, please. Your bio will be on the screen, so just not too long on that one. And then we'd really appreciate if you could tell us a bit about the role of pharmacists in your country or region, in general, but more specifically at the moment in response to the COVID-19 pandemic. So if I could start with Andrew, please.
Thank you very much, everyone, and greetings from Australia. It's a fantastic opportunity to join and also hear the views and experiences of pharmacists across the Commonwealth. As you can see from my bio there, I'm a pharmacist and I work at the University of Sydney. I've also worked in hospital practice. You saw from the data previously that Australia's done incredibly well with a population of 25 million and only 102 deaths, 7,000 cases. Australia swung into action early to close its borders and also to enforce isolation. And it's only now that stages of isolation are being stepped out. Pharmacists have been right at the front line of this and recognised as an essential service, so they are required to stay open, and every pharmacy kept its door open and instituted safe practices to allow care to continue. I'm really proud to say that many of our students were also involved in providing that care. Personal protective equipment, hand sanitising and distancing were critical elements, and also explaining this to their customers. In Australia, like many countries, people see their pharmacist often a lot more than their general practitioner. One of the challenges in hospital pharmacy was the need to manage the demand and the sensitivity around infection. And a lot of the hospitals across Australia replicated their pharmacy. They set up 2 staff profiles, so 2 groups of staff and 2 pharmacies, so that they were able to practice safely. And if any of those staff were exposed to the virus, they could isolate a whole staff but still maintain their continuity of practice. Just lastly, and I've got other things to add later, but one of the things that happened very quickly were innovations around telemedicine, which also allowed pharmacists to conduct medication reviews by Zoom and other platforms. Pharmacists were actively involved, of course, in flu vaccination, as were many of our students at the university, and were able to also institute electronic prescriptions to allow pharmacists to receive a prescription after a Zoom consultation, the patient with their GP, and to send that medicine out. So maybe they're just some of the examples of where pharmacists took a really active and I think innovative role in helping to manage COVID-19 pandemic in Australia and New Zealand. Thank you.
That's fantastic. Really great to hear that. Marvellous. And we'll look forward to speaking to you later in the panel discussion. So if I could now move on to Winnie from Uganda. Hi, Winnie.
Hi, everyone. My name is Winnie from Uganda. And I'm a lecturer at clinical pharmacy from Makerere in Makerere University College of Health Sciences. And I'm part of the antimicrobial stewardship committee at the Ministry of Health. So mainly the roles where pharmacists are involved in my country are 4. Just to say that the Ministry of Health in Uganda has the Emergency Operations Center. And at this center, the pharmacists are involved in the incident management where they are team members and they work with the epidemiologists to help with the surveillance of the pandemic. Then we have pharmacists being part of the logistics committee at the Ministry of Health. And that at this committee, they ensure that all public health facilities have drugs and the other supplies that are required. Then we have capacity building by pharmacists at the academia and non-government organizations like the Infectious Disease Institute. Then we have pharmacists also helping with data collection, analysis, documentation, and information sharing to inform Ministry of Health policies. And these are mainly in academia and the Ministry of Health. And not to forget that we also have the pharmacists in the community pharmacists that ensuring that all the community has the required medications and supplies as previously mentioned. In brief, that's it.
Thank you, Winnie. That's fantastic. Really great to hear what's going on in Uganda. We've now moved to Anri from South Africa. The floor is yours.
Good afternoon, everybody. You can see my bio. I'll just highlight to say that I've worked at the Pharmaceutical Society of South Africa and I've been there since 2009, 2 years after I was registered as a pharmacist. So basically I've grown up in professional association and that's my life and my passion. About pharmacists in South Africa during this pandemic, obviously we have the community pharmacies and the hospital pharmacists who are essential services and stayed open during the whole time. South Africa is now only beginning its peak, but we are also opening up some of the lockdown regulations, which is quite interesting. So we are still in for a bit of a rough ride, I think. A lot of the time now, pharmacists had to manage patients with chronic medication, patients whose prescriptions has expired and they still need to have a continuous supply of medication. We've also had some issues where, especially patients with mental illnesses, had issues obtaining care from either psychiatrists, psychologists, or their doctor. So there was a lot of work from the pharmacist side to collaborate with doctors to find scripts and to make sure that patients do continue their care. We are also play a big role in information sharing to the public because we are so accessible. You don't need to pay us for services. You don't need to make an appointment. You can just pick up the phone and call your pharmacist and get information if you're worried about symptoms or anything. But I think interestingly enough, and one thing I want to highlight that also happened in South Africa, not directly clinically related, but we have pharmacists involved in the business side of the managing the COVID pandemic. Pharmacist is part of the panel that is sourcing PPE for the country for both public and private sector, involved in information sharing to the Minister of Health and his team who's making decisions. So I think that is quite interesting that pharmacists in South Africa were able to go beyond the usual and being involved at that level and informing the government about what is needed by pharmacists on the ground so that we can do our work. Thank you.
Thank you. That's brilliant, Anri, and I think that really highlights how actually if you have a multidisciplinary group of people involved, particularly in a pandemic, it's going to just be a lot better. So we're now moving to Singapore. Hwalin, over to you. Are you muted?
Hi, good day to everyone around the continents. My name is Hwalin. I'm an infectious disease specialist pharmacist practicing in National Center for Infectious Disease in Singapore. So besides my role in the daily or clinical roles in my hospitals, I lead a team of pharmacy where we do run our screening center, which we specifically set it up to screen suspects of our COVID-19 patients, instead of like mixing the patients with the usual emergency department or patients. So besides the typical day in, day out medications reviews, we do go out when more and more COVID patients are admitted to the hospitals. We are not able to contain all in the hospitals, so we do send most of these patients to our community facilities. So in order to ensure that we have we are able to sustain the medication supply, we do send a team of pharmacy to community facilities to support all these medications supplied to our patients. So the other challenge, one of the challenge moments that we do face in Singapore is really sustainability of resources. We do import most of our medications from everywhere. So especially at this point where most of the ports are being closed, or even like, in Singapore, we close our borders. It's really a challenge to really ensure that we have enough resources, not only for any repurposed drugs that's used in COVID-19, but any other chronic medications that our patients use day in, day out. So that's something that we have to tackle even till now. Yep. That's all. Thank you.
Thank you, Hwalin. That's fantastic to hear how you're getting on in Singapore. Great sharing. We're now moving to Trinidad and Tobago. Anesa, if you'd like to tell us how you're getting on.
Hi, good day, everybody. Thank you very much for the opportunity. It's a pleasure and an honor to be invited to this webinar. Thus far in Trinidad and Tobago, as we all know, we just have 117 cases. I think we've done quite well. And out of those, just 8 deaths. And being a third world country, it was really very difficult for us to be able to get resources. So pharmacists in Trinidad and Tobago have gone beyond the call of duty, basically, because they're basically what we call.
Hi, can everybody else hear Anesa? Is it just me that's lost her?
No, I've lost
I think she's got on mute.
Shall we come back to?
Hi.
Oh, are you there, Anesa?
Hi. Yes, I am. Sorry.
Sorry, we lost you briefly. Carry on.
Okay, so just saying that Trinidad and Tobago has done quite well, we think, in terms of right now our curve is flattened at this point in time, and we hope that it stays very much the same way. Pharmacists in Trinidad and Tobago have gone beyond the call of duty, both in the public and the private sector. Public sector, which basically took the entire challenge of the management of COVID-19, our pharmacists would have been working 24/7, ensuring that the public had access to medication, both for COVID management as well as the parallel healthcare system, meaning all of the chronic diseases among other disease states. So in terms of ensuring medication availability, given the fact that we're a third world country, resources were really very limited, and management of the resources was one of the major aspects that pharmacists would have come up to the fore in terms of ensuring that availability of supplies were there at all times. Again, it was a multidisciplinary team, and they worked hand in hand with all of the other members of the healthcare team. With respect to the private sector, again, information sharing among pharmacists, as well as the patients being able to reach out to the pharmacist to get information about COVID-19 among other disease states. They have been able to provide such services. So basically, I think that we have done quite well. And in terms of pharmacists going out of the realm of pharmacy, I do know that from my experience, supply chain, logistics, and financial management would have been the portfolio from the Ministry of Health that was given to me. And it's outside the realm of pharmacy. But I think in Trinidad and Tobago, pharmacists would have done quite a good job in the management of COVID-19 together with our parallel healthcare system. Thank you.
Thank you. That's fantastic. It's great, as others have contributed already, to see such a multidisciplinary approach. Working with the ministry also key. So finally, we will move to Manjiri from India. Over to you. Are you unmuted? Are you, Diane, can you unmute Manjiri?
Hello everyone, I'm Manjiri. Namaste. I'm an academic. Now it's okay, right? I'm an academic from India. I'm the Vice President of the Indian Pharmaceutical Association, and I'm the Vice President also of the Community Pharmacy section of FIP, the International Pharmaceutical Federation. Talking about the COVID pandemic in India, we continue to have the cases, but the death rate has been really low compared to many other countries. The pharmacist, my colleagues have already talked about the role of pharmacists. Just to add to that, the pharmacist in every sector in India, the community, the hospital, the regulatory, and the industry, they stood up to the challenge and they have been doing their best during this last 2.5 months of pandemic. Regarding the community pharmacist, who are the frontline health workers, who are the face of the profession. And you know how many community pharmacies we have? We have more than 0.7 million. Right, that is more than 700,000 community pharmacies in India, and they have taken up this challenge, and they're working very hard to maintain the uninterrupted to the community. They face challenges. Our shops are very small roadside shops. So creating the social distancing was one of the first challenge that they faced, but they overcome that by using their creativity. And one more challenge was the supply chain. The doorstep delivery of the medicines was affected. The distributors were not delivering the medicines in the pharmacies because of, you know, the lockdown, because of lack of staff. And therefore the pharmacists had to run around to maintain the medicine supply, but they did that. And one more challenge they faced was the private doctors, the private physicians stopped working. And so it was all up to the pharmacy to face the patients. And so their interaction time with the patients increased enormously and telemedicine started. So the pharmacists had to do a lot of counseling to the patients, talk to the doctor, get the prescription on the WhatsApp. And so it was a lot of hard work for the pharmacists, but they have been doing that, as well as the pharmacist in the hospital. They have been doing everything from dispensing to the emergency work. And the pharmacy of the world is India. So the industry is working very hard to maintain the medicine supply.
Fantastic. Thank you so much. I think I've already let us run a bit over, so I'll hand back to Vicky, I think. Is that right?
Thanks, Sarah. Yeah, sure. Diane. So Diane's going to do some timekeeping for us now, just to make sure that we finish on time. So if you hear Diane coming in, that means that your time is up and we've got to move on. So if we just move on to the next slide. We're going to start the panel discussion now. Diane, if you've got the next slide there. We're going to kick off with the first question to our panelists, and that is, can they give examples of effective clinical management of COVID-19 patients by pharmacists? And I wanted to direct this to Hwalin to start with. So Hwalin, tell us a little bit about the effective clinical management of patients in Singapore.
Thank you, Vicky. I would say that it's more of a collaboration work with the physicians in managing our COVID-19, our COVID patients. So at the beginning stage, I would say, where we are trying to look out for repurposed drugs, the use of all the various repurposed drugs, or we do sit down together with the physicians and try to draft out some guidance and guidelines and look at all the data that is available around the world to see which are the ones that we could potentially use in Singapore. So one example would be the use of, at the very initial stage, the use of Kaletra for our COVID-19 patients. So what we do will be the daily monitoring of our patients, and at the end of the day, you know, we do collect data and monitor the outcomes for all the patients that is on all these repurposed medications. So some of the other repurposed medications that we have used, right, besides Kaletra, would be like together with beta interferons, earlier stage where there are some, you know, controversial discussions on hydroxychloroquine, and even to the latest remdesivir clinical trials that we do participate in. Yeah, and then lately would be more on IL-6 receptor antagonists on tocilizumab. Yeah, so we do monitor the outcomes, and then we do share with physicians, and for any particular treatments that we deem that probably don't have much data, solid data to support its continued use, we do remove that from our guidance to ensure that doctors don't use that particular drugs again, you know, unless it's really there's no other options. Yeah. So the other thing that I thought is interesting to raise in these managements of COVID patients will be actually by the medical team, where they actually introduce this early wake or more of like wake proning of the patients. So especially for patients in the ICU, in the critical care unit, where, you know, the patients are intubated and they could be put into prone positions for better oxygenation. So what we do, right, we actually do that in the general ward before patients actually deteriorate. So it actually helps the patients and prevent their needs to actually be admitted to the critical care unit. And we do see a lot of success in these patients, and they do perform well. Yeah.
Vicky, you're on mute.
Technically challenged. Sorry, Diane's had a bit of trouble with her IT, and I just had some there as well. So hopefully you can see my screen again now. And thank you, Hwalin. That's a really insightful share from Singapore. I know you guys are really clinically orientated, and it's really nice to hear how pharmacists have been involved there. So thank you. Andrew, I just wanted to ask you, following on from that, if it's okay, about some of the initiatives that you highlighted to us in the questions you sent back. So you mentioned some initiatives that pharmacists were involved in there that have helped to support COVID-19 response. Do you want to just elaborate on those for a minute?
Yeah, so maybe just a couple, and actually they certainly build on other themes that we've heard from our colleagues around the world. I think the role of pharmacists, and maybe one example I'll share with you is through the university. We set up a student-led vaccination clinic. So we train pharmacy students, and pharmacists actually help train medical students and nursing students on vaccination. And in our pharmacy school, we vaccinated over 500 health students who were going on placement during the peak of the pandemic in Australia. And the student workforce, whether it was in pharmacy, medicine, nursing, and other allied health, actually provided a very important buffer within the health system, given the demand and the peak of the pandemic. Vaccination was a critical part of that, so it was very important that actually people were able to do that. So that's one example of how we certainly changed and adapted our practice so that we could meet the current demand of what was needed for the pandemic.
Thanks, Andrew. Can you hear me, everyone?
Yeah.
Thanks, Andrew. I think that's really interesting innovation. I don't know if anyone else has come across that, and maybe we can pick that up in the discussions a bit later on. So I'm going to hand on now to Sarah to talk about the next part of the discussion. So Sarah, over to you.
Have you got the question on the next slide?
Yeah. There we go.
Oh, sure, great. So I think we've had a lot of questions about how we maintain antimicrobial stewardship and the appropriate use of antimicrobials during this time. And I'd like to thank the panel. I think pretty much everybody has come back with what you're doing in your countries. But if I could perhaps first ask Winnie to let us know how you're dealing with this in Uganda, if there's anything you can share, and then possibly either move on to Hwalin or Anesa or any of the rest of you. But Winnie, would you start us off, please?
Okay, so with regards to that, one thing that we all need to remind ourselves of as pharmacists is the definition of what antimicrobial stewardship is. And then when we recall that, we need to understand that antibiotics should not be used in the management of viral infections. And that as a key message, we need to also work with the scientists to understand how to control the COVID-19 pandemic. It's crucial to prepare for the effect of the current and future viral pandemics on secondary bacterial infections and the resulting impact on antimicrobial resistance. In Uganda, we have the Commonwealth partnerships for antimicrobial stewardship in the different hospitals distributed across the country, and these helped come up with different policies. We have one on infection prevention and control. Then we have some partnerships that have come up with the manufacturing of the alcohol hand dry. And with this, I think as pharmacists, we need to work together and not forget that antimicrobial resistance is a big challenge globally. Even in my country, it is. And that bacterial infections are a significant cause of morbidity and mortality during the viral infections, because there is so much uncertainty with regards to use of antibiotics. Some research has reported that it has anti-inflammatory activities. And in my country, the policies are not yet, even when we have the guidelines on the management of COVID-19, the information is not so straightforward, and there's so much uncertainty and misinformation going around. So we need to remember and have concrete evidence before we start the use of antibiotics in the different hospitals as pharmacists. And also to just echo what my colleagues have said, working as a team with the different health professionals is maybe part of the solution to proper antimicrobial stewardship and control of antimicrobial resistance.
Thank you, Winnie. That's really helpful. One thing I've picked up on that, and also others have said, is as a result of the COVID-19 pandemic, perhaps less so in Uganda, but certainly in our in England and the United Kingdom, the hand hygiene, the good etiquette when sneezing and all the rest of it, this is something that's actually going to be taken forward and will reduce other bacterial infections and other infections in addition to this virus. So it's really important to have good stewardship at the heart of this. And I think we commend what you're doing in Uganda. Did Hwalin or Anesa want to say anything about this, or any of the other members of the panel?
Yeah, Sarah, in India also, as you said, that the health and hygiene factors, that is hand washing and also the cough hygiene, the respiratory hygiene. Now this has been, we were trying to create awareness about it since long, but COVID has made it possible. And now the citizens know the importance of these habits, and we hope that it will be continued, and that will decrease the use of antibiotics, because it will reduce the respiratory infections and GIT infections.
Yeah, and I think that's really, it's really key. In our country, I think we came out of our normal flu season a bit earlier, because people were actually doing, as you said, so, this is something we can take forward.
Yeah.
I know we're conscious of time, Vicky, do we need to move on to the next question, do you think?
Yeah, just a question for Andrew before you move on. Andrew, can you hear me? The question come through on the chat box for you, asking about what processes did your pharmacists or students carry out to protect themselves or the patients while engaging in the flu vaccination program? Was it just PPE?
So actually, PPE wasn't a critical part of it, but actually screening of people prior to coming for vaccination, as you would normally do for a flu vaccination. People who are unwell shouldn't get flu vaccination. So it was about screening, and once they were in, of we actually did this in our pharmacy building at the university. We had the space to maintain social distancing. We also had very strict hand hygiene protocols, and actually with the right screening and those protocols, we were able to, safely vaccinate people. Obviously, where there was any concern or cough or wheeze, face masks were certainly available. But the current guidelines, international guidelines for vaccination, don't necessarily require glove wearing, for example. So it was about being aware of the current process and making sure that we added on those current measures that everyone speaks about to minimise the risk of COVID-19 exposure.
Thanks, Andrew. That's really helpful. I hope that's answered the question. There was just one more question here for Hwalin. Hwalin, have you, can you hear me?
Yep.
So question for you in the chat box. I don't know if you're following the chat box.
Yep, I saw the question.
Oh, you did? Okay, so were medicines in Singapore given with informed consent under the clinical trials protocols?
So for the remdesivir clinical trials, because it's a clinical trial, informed consent will be taken for the patients. But for all those repurposed drugs, right, we actually seek approval from our medical board as well as our ethics committees. So it's more of a verbal. We still speak to the patients and their family members and get their approval before we actually give them the medications. So if the patients are not particularly comfortable in taking, example, Kaletra or hydroxychloroquine, we'll document and will not give it to the patients. So it's not really like a formal informed consent, but we do still communicate to the patients on the risks and benefits of the medications and the data that is available.
Okay, because they're already licensed for something, aren't they, anyway?
Yeah, correct. Yeah. Correct. It's just repurposed for other purpose.
Okay, thanks, Hwalin. That's really helpful. So let's move on to the next question, shall we? Sarah, I'm handing it back to me. Is that okay?
Yeah.
I'm already speaking. So the next question is around PPE. So we've asked how are pharmacists access PPE? How are they using it? I know this has been quite a controversial topic around the world. So I just wanted to ask a few of you what your experiences were. So Manjiri, do you want to tell us a bit about this to start with?
Yes. So we had tremendous scarcity of PPE as it was in the entire world. And the pharmacists in the community, the private sector pharmacists, they were never given any PPEs from the government, but they had to procure it themselves. And so they did it. And also their associations, some of the trade associations gave them the PPE kit, but there was no particular training given on it. We at IPA as well issued some advisories, as well as we referred to the FIP, FAFA and CPA resources, and we gave it to our pharmacists so that they know how to use it. And in the hospital, yes, some training was given and the PPEs were given to the hospital pharmacists, but also it was, they were not the first priority because the doctors had to be given PPEs, the nurses had to be given PPEs, then comes the pharmacists. So they were not enough. Not everyone got the PPEs easily. So that was the scenario.
Thanks, Manjiri. That's really interesting. I think many of you can relate to that scenario as well. Anesa, can we ask you just to chip in here? I don't know if you can hear me, can you? Anesa, are you there? From Trinidad and Tobago's point of view, have PPEs been used, or what's the story there with that?
Okay, so with respect, hi everybody. So with respect to PPEs, Trinidad and Tobago, at the ministry, I was given that portfolio in terms of management of PPE for the entire country. So within the public sector, when I say the entire country, I mean public sector basically, primarily. So with respect to the public sector, like Manjiri would have explained, the pharmacists were not basically the front line. Hello? Hi. Hi, you're hearing me?
Someone's not on mute.
Hi?
Please,
we can hear you, thank you. If everybody else could mute, that would be fantastic, thank you.
Okay, so as I was saying, with respect to our public sector pharmacy, all the pharmacies and the public sector institutions do have an interface. And as Manjiri was explaining, the PPE were directed basically to the frontline healthcare, meaning the doctors, the nurses, those who would have been in direct contact with an asymptomatic or a patient presenting to the institutions. So PPE were made available to all public institutions, and they were guided by what we have, the infection prevention and control units available, and they established in all of the healthcare units in our country. Pharmacists are an integral part of that unit as well, guiding the use of disinfecting agents and any other agents, pharmaceuticals that are used in that area. So at the private sector, the private pharmacies, they would have also instituted measures, having an interface, ensuring washing of hands, ensuring the patients coming in do have masks on, ensuring they're 6 feet distancing. So we would have abided by the WHO guidelines given to us, and all pharmacists would have been doing such. So the sourcing of the PPE, however, would have been our greatest challenge and still remains a great challenge like everybody else's. So in terms of strengthening the system and supply chain, we would have done policies in terms of the use. However, we're still trying to advocate if it can be procurement regionally or from an international body. So those things are still in train. However, we've been able to manage as best as we can in terms of guiding it for the proper, efficient, and effective use through our IPC guidelines within the public sector.
Thanks, Anesa. That's really helpful. I think, again, other people can probably relate to similar situations. And I think maybe we will move on to sort of discussing a bit more about that at the end. So I want to hand back to Sarah now to take the next question, which is.
Thank you. This came up an awful lot in the chat after the last webinar. And I just wondered, and I'm going to open this up to the whole panel, how the approaches to vaccine development and the clinical trials in response to this have been managed in your countries or regions. It's something that's been in the press, and I think we're all doing this differently. So would anybody like to kick off with that, or should I pick somebody at random? Because you all have things to say.
I can make a quick comment.
Please do. Thank you, Anri.
I think what's been amazing, of course, is that for previous coronaviruses, we've not seen a vaccine developed. That's the nature of the virus and, of course, the technology that was available. And since SARS and MERS, there's been incredible development in the technology available for vaccine development, many different methods, many different strategies, including some of the things pharmacists do well, or pharmaceutical scientists, around formulation. So what's been amazing has been the global effort. So while I do think there are regional developments, now more than ever, the international collaboration is really quite incredible, which gives us a lot of promise in seeing the possibility of a vaccine, and particularly steps in Australia, but many countries around the world where already early phase trials have commenced, often in collaboration with international consortia to look at the testing of vaccines. You know, they focus on things we know about the vaccine, about the surface proteins, about some of the key elements that modulate the immune system. So this is really an amazing and interesting time to see vaccine development. So while we haven't got a vaccine yet, this has got to be the best chance that we'll ever get one, based on, you know, the increased technologies. Researchers in my own school are also actively interested in looking at adjuvants, which can enhance the response to some of the vaccines that are out there. So you can see that there are many smart people, a lot smarter than me, who are really taking this on. So it's exciting.
Surely not. Anybody else like to comment?
I can just say that around 60% of the world's vaccines come from India. So when the vaccine is researched, then the production will be definitely happening, part of it, major part of it in India. Already there have been many collaborations, and the trials are starting. There has been collaboration with Oxford University by one of the institute in India. And so we are hoping for the best. Let's see how it goes. Yeah.
Fantastic. I mean, well, one thing I think is really interesting, given that we are having this webinar across the whole world, is Australia is in the southern hemisphere. You're having your seasonal flu now, and you're using your student workforce. And I think if and when the vaccine becomes available, that's going to be really interesting if we can actually roll that out and learn from that, as well as the other countries. Did anybody
Sarah,
else have any
the access to the vaccine is going to be a critical issue, isn't it? Once we have a working vaccine, that affordable access and then the distribution networks must involve, pharmacists. And I think that, as a workforce, we're really well placed to see a global effort there. But of course, there are many ethical and economic aspects to this as well, not just the technology. So I think we all wait with bated breath.
Anri from South Africa here. If I'm allowed to quickly just pop in and say something about the vaccines. Obviously, South Africa is also taking part in global research with vaccines and treatment. However, what would be interesting to see, being South Africa specific, is pharmacists in South Africa is allowed to do vaccinations already. So normal flu vaccine every year, we are allowed to administer the flu vaccine without prescription or intervention if you are trained. So the same would happen to the COVID vaccine once it is available commercially. However, I do think in South Africa every year, we never get enough flu vaccines for everybody. There's always a resource constraint. And it would be interesting to see, I do feel we're going to have a similar situation with the COVID vaccine once it is available. And we have a lot of other diseases that create such a burden in South Africa that it would be interesting to see how far are we going to get with supply in South Africa for COVID-19 vaccines once it's available. I think we're going to have a similar situation to the flu vaccine, that every year we get a certain number of doses, and once it's finished, it's finished. And I don't think it will continue to remain such a big focus in South Africa. We're seeing we've got so many other problems.
I think that's feedback we've definitely had from other countries as well. It's the burden of disease. Other diseases are being impacted by this so much. Diane hasn't told me this explicitly, but I think we need to move on time-wise.
Yeah, definitely. So Anri, while you're there and you're talking and you're on a flow, I wanted to ask you about the next question about the experiences of dealing with mental health issues during this pandemic, because you raised some interesting points to us.
Yes, well, my first point would be that according to me, and I've now looked at numerous countries, and I might have missed something, but specifically South Africa as well, I haven't seen actually really that anybody was doing anything substantial dealing with the mental health issues of healthcare professionals. Definitely not on an official government level at all. The interventions we have seen is all association-based level or volunteer level. So we do, for instance, in South Africa, there was 4 associations that got together and created a platform. EMC Guidance is the platform's name, whereby healthcare professionals can put their details and they can be contacted by somebody who's an expert in mental health issues. If you're feeling overburdened, stressed, overworked, somebody will contact you back, and it's a volunteer-based system. But it was all done volunteer-based. And I do feel South Africa specifically, especially, we are opening up from lockdown, strict lockdown, to more relaxed lockdown, while our curve is only now starting to climb. So we are still going to get a lot more overworked. And we've been sitting and waiting for 3 months. You know, it was lockdown, it's COVID-19. Everybody was, can I say, prepared, and we were busy getting ready. And then almost nothing happened because the lockdown was so early. It took a long time for us to start building up. So now for 3 months, we've been sitting waiting in this fight or flight scenario, which is already draining. You don't know what to do because you're waiting for the storm to come, but the storm hasn't come yet. And now the storm is only coming. And now it's going to be quite draining on our healthcare staff. We're also seeing that deaths are starting to increase, and we're seeing that a lot more healthcare professionals are getting infected, which we also know plays a big role. So I'll be honest and say, I don't feel enough has been done. The society itself has done a webinar the other day, specifically just for fun, we had a quiz night, and it was just for pharmacists, and it was a fun quiz night. So it was not COVID related, it was not medically related. It was really a fun quiz night to get pharmacists to interact with one another without thinking about COVID, without thinking what's going on at work, do I have PPE? And it was so well received. I think it really made a difference to the pharmacists who attended. For an hour, you could interact with other healthcare pharmacists, and you didn't think COVID, you didn't think, oh, what's going on, what's going to happen. You were talking about sports and movies, and it was, I think it really helped. And I do feel a lot more needs to be done to help healthcare professionals, because this is an extremely, extremely stressful and draining situation everybody is in.
Thanks, Anri. I think that's a really important point we raised, and I think maybe you know, as time goes by, we'll definitely learn from this pandemic as well, because I think maybe it's something that we haven't experienced on this global level for like at least a generation. So I hope that it's something we learn from it, but like you say, more provision could be made. And Manjiri, I just wanted to pick up on something you said here as well about the mental health effects on the public as well, because it's not just the healthcare professionals, which obviously is a big thing, but the effects on the public, especially on isolation and, you know, not being able to get out and see people.
Yes, so there has been, you know, there was rather, now it's decreasing, but a lot of fear in the minds of the people. And there have been many issues which affected the citizens' health, mental health, basically the worries about their future and, you know, financial situations, etc. So many of the patients were coming to many of the consumers were coming to the pharmacy asking for the sleeping pills and without the prescription. And the psychiatrists were not available, and there was an issue. Many times it also happened that the people did not get, who were addicted to alcohol, did not get an alcohol. And so they had problems because of that kind of withdrawal, because alcohol was not made available in the first 3 phases of the lockdown. So people suffered a lot, many of the people suffered on mental health front because of the insomnia, because of the worries, because of the fear of future, and because of maybe the, you know, not getting available, not the unavailability of the alcohol or many other things. And so the pharmacists had to do a lot of counseling to these patients and persuade them to call the psychiatrist and get the prescription, and then only it could be dispensed.
Okay, thanks, Manjiri. That's really helpful.
Hi. I just wanted to add, hi,
Anesa.
Yes, I just wanted to add, in addition to what Manjiri would have said, us here in Trinidad would have also had anxiety and depression, because during the lockdown, a subset of the population were unable to go to work, and a lack of income would have also been another factor in terms of depression. And at the ministry level, we would have set up a hotline so that the public can call to get that sort of mental health assistance or consultation with the physicians. And that is what we did in Trinidad and Tobago, because mental health was a big issue, a big part of our response and management. And the hotline, the setting up of the hotline, even to the patients who are in isolation, they would have had consultations, ongoing consultations with the physician. And again, the pharmacists at the public health institutions as well as private sector would have also provided consultation, communication to the average person coming in with those challenges as well. So I just wanted to add that component from Trinidad and Tobago.
Thanks, Anesa. That's really valuable as well. I think there's been a lot of really interesting points here, and just wanted to highlight that we're hopefully going to write this up, and some of these discussion points will then be available for you to kind of refer to if that's helpful. But obviously this webinar will be recorded too. In the context of time now, I think we're going to have to kind of move on to our last question and start wrapping up. I know there's so much more we could talk about, and I think there's definitely room for at least one other webinar here. So I'm going to hand over to Diane just to wrap up and just talk about the final question briefly.
Thank you, Vicky, and thank you to all the panelists. I've learned so much from listening to you, and it's great to see some commonalities in the way that pharmacists have been tackling COVID-19 across the Commonwealth, but also some innovative ideas that we can all learn from, and perhaps the shared learning that we can also take across. So in this wrapping up section, I just wanted to ask if, starting with Winnie, if I may, if there's anything else you wanted to add, Winnie, in terms of any innovative approaches, the challenges, or recognition, specifically any specific recognition given to pharmacies. So we'll start with Winnie, and then we'll ask if anyone else on the panel has any further thoughts to share. And we said this was going to be an hour, but we're going just slightly over. So we hope that many of you will stay with us for another 5 or so minutes so we can just conclude. So over to you, Winnie.
So in Uganda, in order to overcome the challenge of the PPE, the logistics committee, which is majorly made up of pharmacists, suggested that the PPE should be used in accordance to the place where the pharmacist is placed, or a healthcare worker. For the healthcare workers and pharmacists that are within the clinical treatment units, they'll have to wear the full PPE. And the ones that are within offices, they only have to use a mask, or within the monitoring units, they only have to wear they don't have to don the full PPE. Then we have the case management sub-pillar, which is at the Ministry of Health. And within this sub-pillar, pharmacists have come up with a telemedicine guidelines, because in Uganda, telemedicine was not really used. And we have also come up with the case management guidelines to guide the doctors in the correct choice of antibiotics and other medications.
Thank you, Winnie. That's really helpful. I don't know if any of the other panelists wanted to say, if I just say your name, and then if you unmute yourself, or otherwise just let us know that you haven't got any further comments. Anesa?
Hi, so Anesa, Trinidad and Tobago. Just wanted to say, with respect to the management of PPE as well, system strengthened, and innovatively, we've partnered with the University of the West Indies. They have produced the face shields thus far, because they've repurposed their engineering unit. And we are we are in the process of doing surgeons' gowns, as well as in the process as well of making our own masks, N95 masks, following guidelines. So in terms of innovation, we have started that already in Trinidad. So hopefully we would like to, that should be available to the region, but we started that. That's our innovative out of COVID-19 with respect to PPE.
That's
we
brilliant.
appreciate all the responses. Thank you.
Okay, and over to you, Anri.
So I just want to make a quick point about recognition given to pharmacy. In South Africa, and I know in a lot of other countries as well, oftentimes pharmacists would be seen as allied health professionals. They talk about nurses and doctors, and they don't mention pharmacists. So during this COVID-19 challenge, and with everything we've been doing as pharmacists, we have managed to be recognized individually. So our Department of Health and our Minister of Health now on Twitter individually recognize as pharmacists, and we are seen as frontline, and we are also part of the Healthcare Heroes campaign they're doing. So I just want to say that's one small positive that came out of this, is in South Africa, pharmacists are now recognized individually, and we are no longer seen as just allied health professionals.
That's wonderful to hear. Hwalin?
Hi. So in Singapore, when more and more, actually before COVID pandemic, right? Not many of our patients actually wanted to have home delivery of medicines to them because of some confidentiality issue. So when this pandemic starts, we try to discourage patients coming back to hospital to collect medications. And surprisingly, actually a lot of our patients took up home delivery services, and our government actually waived the delivery charges for all these patients. So they only paid for their medications and not the delivery fee. Even for my HIV patients, where they do wanted their confidentiality and their family members don't even know, right? They actually wanted these home delivery services as well, which I thought is it's a great thing for pharmacy to be able to provide such services to the community, to the home, directly to the home of our people. Yeah.
Okay. Thank you. Manjiri?
Hi. So regarding the innovation, the telemedicine became official in India first time. So going forward, we see the future where the pharmacist will have an added dimension, additional dimension of receiving the prescriptions on the email or the phone and so on. Also regarding the recognition, I congratulate my South African colleague, and also I have seen a lot of recognition coming to the pharmacist in many different countries, including UK, the Prime Minister appreciating it, and the video was viral in India. So in India, we had not been that fortunate. So the recognition, like everybody, when all the high authorities, when they talked about the frontline warriors, the pharmacists were left behind. The doctors, nurses, police, and all media, everybody was appreciated, but not the pharmacists, except one minister who appreciated the pharmacists. He tweeted, and so it was good encouragement. But overall, we did not see a lot of appreciation or recognition coming. Also, the government had an insurance policy for the health workers who are coming directly in contact with the COVID patients. But there, we don't think the pharmacists are included in that. So we wrote a letter to government for this advocacy. So even though there has not been direct recognition from the government, what we see that it is increasing awareness about the role of pharmacists in the public, who is the end user of patients, end user of the medicines. And that's very important that the public has realized the importance of the pharmacist and how they're sharing the burden of the health system, and how they're important, how like they are the only ones who were open, in most of the time, and doctors were not there, and the pharmacies was the only health destination for the patients. So that is something very important. And I think slowly the recognition will come from the government too. We hope for that and we struggle for that.
So to encourage you, the UK recognition wasn't straight away. Our pharmacy organizations had to do a lot of advocacy, yes. Even for the insurance. I mean, pharmacists have always been recognized. We're not saying that, but when it came to actually specifying and stating, there was advocacy done. And so that was really led by the National Pharmacy Associations, the Royal Pharmaceutical Society, NPA. So that's to encourage others that when the role of the pharmacy associations are quite key in advocating.
True. Yeah, we need to know. Yeah.
And Andrew?
I think I'd echo the experience around the world. Pharmacists have had increased recognition. I think a lot of that came down to the role of advocacy from the professional organisations in the provision of information, but also highlighting the role that pharmacists provide. I think recognition as an essential service and the support that provided during lockdown became absolutely vital. And I think the role that pharmacists have played has been recognised through, as we've heard in other countries, telemedicine and remuneration for conducting medication reviews online, which was a very new funding opportunity. Lastly, the WHO Global Patient Safety Challenge, the third one, Medication Without Harm, has provided a really important framework for how we counsel patients who are asking questions about the repurposing of medicines for use against COVID-19. So there's no treatment at the moment. So we're often finding pharmacists having to explain to people, why this treatment is suitable or not. And our regulator has made it very clear that many of these treatments are only appropriate as part of a clinical trial. And pharmacists have certainly been at the forefront of that. So thank you very much.
No, that's really amazing. Thank you all for sharing those last words with us, and hope that those on the call have had an opportunity to be inspired to hear, and other pharmacy associations that are on the group. Please do reach out to any of the members of the panelists to ask about their advocacy roles, and again reach out to CPA, because that's one of the key roles that CPA has, is around advocacy and supporting associations with those advocacy. So we're just going to talk to the next steps now, and I'm going to hand over to Vicky, and then we will end the webinar.
Thanks, Diane. Hope you can all hear me still. So just to say thank you very much to our participants, and for those of you that have dialed in, I hope you found today interesting. We certainly have. There's loads of nuggets of information coming through, both in the discussion and the chat box here. So we'll try to put all those into some kind of document for you moving forwards. Just to highlight that I know a lot of you have asked about certificates of attendance, so if you do want to get one of those for this, we will be posting some questions up in the next week, so you can answer those questions and then receive your certificate. If you want any more information, that's the email address on the screen there that you can use to get information about the COVID-19 webinars or anything else related to that. Just on the screen there is our web address, our Twitter handle, and some of the hashtags that we've been using if you want to follow some of this on Twitter. And as part of the follow-up, the questions that we will pose for you to get your certificates, we will also be kind of asking for your thoughts on other topics that you want us to cover, or questions that you feel that we could pose to panelists in the future. I think we probably have got room for at least one more panel session, if not more. We've obviously got 54 countries to consider in the Commonwealth, and we've only touched on 5 or 6 today. So thank you very much for your attendance, and we hope that you found this useful. So that's all from us, really. Unless anyone's got any burning questions, we'll let you get back to your important jobs.
No, nothing from me. Thank you all very much. This has been an honor for us to host this, and hopefully you found it as shared learning and not a duplication of what else is going on from what we shared last time.
Yeah.
Thank you very much, everybody.
Thanks. Is that Raymond?
It is, yeah. It's great webinar.
Raymond's our immediate past president, so it's nice to have you on the call as well. Thanks, Raymond. Appreciate your support, everybody.
And once again, a massive thank you to our panelists. We couldn't have done this without you, so thank you once again.
Thank you, Vicky. Thank you, Diane, and thank you all the participants. It's really wonderful to hear the responses from various people all across the Commonwealth.
Thanks, everybody.
Thank you very much, and have a good one, everybody. Stay safe. Bye from Trinidad and Tobago.
Thank you. Bye, everyone.
Bye. Thank you.
Bye. Bye. Thanks, Hwalin.
Okay, bye. Thank you so much.
Thank you. I'm going to...
Thank you.
Thank you.